So what is very essential? So the first essential thing is that when the patient walks in, you know that you have somehow attracted that person to you. So trust that. And then see what happens between you and him or her in that half an hour, 1 hour, whatever you spend there is a very powerful space. Yes? Don't see that as a test of your knowledge. Don't put everything in that. Yes. That space which is created by the intention of the person who walks inside is very powerful. All you need to do is be sensitive in a way to that space, that whatever needs to happen in that moment for that person to heal must happen. How is it possible that the chore comes to you and says, I want to admit my chori, and he will not reveal to you how he robbed? A thief walks and he will says, I want to admit how I did the robbery, and you are sitting there and he won't reveal this to you. In the same way, it is not possible that a person sits in front of you and does not reveal any peculiarity. Is it possible? Very unlikely. कुछ तो peculiarity होगी ना. तू इतनी छोटी है, तू क्या मेरे को क्योर करेगी? That's a peculiarity. Whatever his or her inner state has to show, उसमें क्या बड़ी बात है? What is all this big deal about? Is there anybody who doesn't reveal what his peculiarities are? Every single person who is in distress, yes, nobody comes for fun to your clinic, right? In Gujarati, normally somebody comes to meet me, I say, what have you come here for? And nobody has told me I've come here for nothing. To say hi to you, to give a hug, आज तक नहीं बहुत आए हैं ऐसे. So normally I say only two categories of people come to my clinic in Gujarati. I said either Manda or Ganda. Tell me in which category you belong. Either you are mad or you are sick. Only these two people see me. Nobody else comes to see me. And the mad will reveal the madness and the sick will reveal the sickness. So if he has come with a distress to you, then that distress has to manifest. It is only a matter of a very preliminary skill how to make it manifest. I am saying very preliminary. How much ever complicated lectures we give you on case taking techniques, bullshit. Because the distress has to show itself. Distress has walked into your office wanting to remove the clothes and become naked. All you need to do is be. All you need to do is be and do nothing. What is the power to be and to do nothing? Because we have become human doings instead of human beings. Yeah. But to understand that, don't carry this huge matka of tension on your head, this huge matka of lack of knowledge on your head, day in and day out, पागल हो जाओगे. If I look at what I don't know, I will collapse here right now. Do you think I can survive if I know how much I don't know? So either I survive in how much I don't know, or I survive in the ego of how much I know. Yes, that ego. None of it takes you anywhere. You carry the ego of how much you know, and you will be flat on your face. Every alternate patient, सीधा मुंह पे थप्पड़. Because the skill of homeopathy versus skill of allopathy is different. The skill of practicing homeopathy is very different from the skill of practicing allopathy. Homeopathy is a science of vital force. Homeopathy is an energy medicine. Homeopathy is a holistic medicine. Homeopathy is about the vital force. Homeopathy is about energy patterns. Homeopathy is about peculiarities, about individuality. And the individualities and the peculiarities do not manifest by doing something. That is why Hahnemann writes freedom from prejudice. Not from, can a homeopath prescribe from his knowledge of materia medica at all times? A homeopath can prescribe from the peculiar symptoms that are elicited, not from his knowledge of materia medica. Are you there? His knowledge of materia medica is not primary. What is primary? The primary is the manifestation of the distress. The primary is the eliciting the disease. And what's the big deal about eliciting disease? Because disease is waiting to manifest. Every patient who comes wants to tell. The problem is there are not enough genuine listeners. If you develop if you develop a image that you are rock solid and you are willing to listen anything, right? You willing to listen anything, that even that which you don't know. I am okay to see and elicit anything which I cannot handle, which I cannot see, which I do not believe in, which my belief system doesn't allow me to see it, which is beyond my knowledge, which is beyond, I may not be able to put this in the right place. I am still okay to listen to this. Once I listen to this, बाद में देखेंगे जो होगा वो होगा. So in that listening is the power. Because what happens when you listen without prejudice? What happens? Say something. What will happen when you listen without prejudice? When the person who is sitting in front of you, what will happen to him if I make you sit in front of me and say, okay, with my open heart I listen to you? what will happen to you? Yes, first the person will feel safe, या कुछ भी नॉनसेंस बोल सकते हैं. What else? जैसा है वैसा दिखेगा. What else? Wonderful. What else? Fundamentally, the distress will clearly show itself. From whatever you see about the distress without prejudice, I am sure you will be able to find some peculiarity. Will you be or not? Every distress is peculiar. Is it or not? उसमें क्या बड़ी बात है? So if you can elicit 5 peculiarities in a case, I certify you to be a most competent homeopath on this planet. I sign behind. That is all you need to qualify as a super MD homeopath. Five peculiarities. Itna really, it is really that simple. Once you learn how to elicit the peculiar, then you will learn how to go deeper into that peculiar.